dear learners, welcome once again to the MOOCs lecture. We are going to discuss Unit 5 of BP 103T, that is Introduction to Semi-Solid Dosage Form. I am Anjali Mishra, Assistant Professor at Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. Let's start. So, in the previous lecture, we had a detailed introduction to semi-solid dosage form. We saw what is semi-solid dosage form, what are the types of semi-solid dosage form, and we had a detailed discussion on 3 types of semi-solid dosage form, that is ointment, creams and paste. In this lecture, we are going to cover the rest of the semi-solid dosage form. Let's start with gels and jellies. So, the thing that usually strike us when we hear this word gel, when we hear this word gel, anything that is going to strike us is translucent, shiny, something sort of like that. So, gel are basically is that sort of semi-solid dosage form only. So, let us understand the characteristics of gels and jellies. Gels are aqueous colloidal system of hydrated forms that usually contain insoluble medicaments. So, gels mainly contains aqueous content in a huge amount, in a major amount. So, they are majorly of aqueous in nature, and usually solid medicament are incorporated into our gels, and that forms a colloidal solution. Colloidal solution are nothing but the presence of solid particle which are in the range of 1 nanometer. So, it forms basically a colloidal solution sort of thing. So, jellies are transparent and they are translucent, non-greasy, semi-solid and contain water as compared to gels. So, gels are majorly, they are transparent, they are translucent and they are often non-greasy when compared to the other forms of semi-solid dosage forms. And the proportion of water content in gels is definitely high as compared to any other sort of solid semi-solid dosage form, be it your ointment, be it your creams, be it your pastes. So, the water content in gels is definitely very much high. Then they are semi-solid to thick viscous fluids. So, they are semi-solid, however, the consistency of gel is high as compared to your paste as well, because they have a gelling framework in them that makes them really high of that makes them of high viscosity as compared to any other semi-solid dosage form. Majorly it consists of submicroscopic particles. As I said, it is a colloidal dispersion and we know that the particle range of colloidal dispersion is from 1 nanometer to 100 nanometer. So, the particle that is present in gels are of submicroscopic level. They are majorly transparent or they are translucent. As you can see in this in the picture that is being represented, the gel is of either transparent nature or it is of translucent in nature. So, let us understand gels and jellies in a more deeper way. Gels basically they are non-greasy and mucilage type. Now, non-greasy is definitely a good characteristics which is being exhibited by this semi-solid dosage form. Non-greasy makes higher acceptability for a patient because the removal of that semi-solid dosage form is high and if the removal is quick and it is of less time taking, it is a desirable characteristics. So, gels and jelly have a non-greasy texture and the removal is quite easy as compared to any other solid dosage, semi-solid dosage form. Their application is often onto the skin or even to the mucous membrane, which is also the one of the important characteristics of semi-solid dosage form. So, the application it is majorly or it can be onto the skin and the application can be onto the mucous membrane as well. Their application is very simple and easy. Application of gel and jellies is very simple, it is very lucid and it is very easy because it is oftenly told to be applied with the aid of finger or with the aid of hands. Sometimes spatula is also being given by the registered medical practitioner, through which you can apply to this apply it onto the skin or into the any of the mucous membrane. As water content is huge, evaporation of water at the site of application gives cooling sensation. Yes, definitely, as the water content is higher. So, whenever we apply gel onto a particular surface, the water that is present in that evaporates, and Whenever this process of evaporation happens, the feeling of cooling sensation occurs onto the affected area on which gels are applied. As a result, the patient gets a cooling effect, which is a good phenomena as well, because any sort of inflammation is being cooled by the application of gels on that particular area. Now, being viscous in nature, residence time is more and eventually action is prolonged. Now, if I talk about semi-solid dosage form, the very first and the foremost advantage of semi-solid dosage form is that it has a higher viscosity, it is of higher viscous range. As a result, what happens when we apply any medicaments of semi-solid origin, it is going to adhere to our skin for a longer period of time. If the action is for a longer period of time, it means the residence time of that medicament or the entire formulation to that particular area is for the longer period of time. If it is applied for a longer period of time, the action is prolonged and the patient need not apply that medication again and again. So, this is a good advantages of all the semi-solid dosage form. So, same is the case with our gels and jelly as well. It have become big because of its high viscosity, the residence time is more, and the residence time is more, as a result the action is being prolonged. However, it can be removed easily with water, and it is also another characteristics because it is non-greasy. So, with the help of a dry cloth or with the help of a wet tissue, it is easy to remove the gel on the affected area from where it is applied. Now, let us understand the types of jellies. First of all, first type is the medicated jelly, another type is lubricating jelly, and the third part is nothing but the miscellaneous. Under miscellaneous, we have many sorts of jellies, that is for protection purposes, for cosmetic purposes, for enhancing the appearance of any hair, skin or to the surfaces. So, that comes under your miscellaneous jellies. Let us understand the first type of gel and jellies, that is medicated jellies. As the name implies, medicated. So, medicated jelly means what? Any jelly that has incorporated API into it, that is active pharmaceutical ingredient. So, whenever we talk about medicated jellies, it has got API plus base in it. Now, API, all of us are aware that API is nothing but active pharmaceutical ingredient. Now, what is base? Base is nothing but into which our API is being incorporated, because without base our API cannot be subjected to a patient. We cannot administer API directly to a patient. For that purpose, we do need certain vehicle. That vehicle is nothing but your base. Another type of jelly is lubricating jellies. Sometimes lubricating jellies are oftenly applied onto various sort of diagnostic equipments for easily transporting these diagnostic equipment into various body orifices. So, for that purposes, lubricating jellies are applied onto these surfaces, so that easily transportation, easily passage of these instruments can occur. So, that is nothing but your lubricating jellies. So, lubricating jellies are mainly used for lubricating purposes. As I mentioned earlier, miscellaneous jellies can be of any other types. Miscellaneous jellies can be for cosmetic purposes, it can be for protective purpose, it can give you emollient action. So, it can be used for any purposes that is going to enhance the appearance of any of the body parts. So, let us understand medicated and lubricating jellies in a more deeper way. So, medicated jellies, they are majorly useful for mucous membrane for purpose of providing lubrication or for antiseptic purposes. So, either if you want lubrication, for that purpose also we can use lubricating jellies, or for antiseptic need. So, definitely antiseptic need we can go for medicated jellies. Now, example here include ephedrine sulfate, which is a vasoconstrictor. So, if we are going to use ephedrine sulfate jelly, it is a vasoconstrictor, and that is an example of medicated jellies. Another is phenyl mercuric nitrate, that is a spermicidal. So, this is a type of jelly that is being used as a contraceptives by various males and females, because that is a spermicidal in nature. Spermicidal means what? It is going to kill the sperms. So, here is another example of medicated jellies. Here we have lubricating jellies. So, lubricating jellies are of various types. They are, so first of all, they are supposed to be sterile, and because they are meant to enter into various regions of the body. As just I have discussed, that lubricating jellies are oftenly applied onto a medicated devices. For example, if a female wants to undergo a TVS scan, that is a transvaginal scan, the instrument that is being used to diagnose the TVS or to understand or to perform TVS activity, that are oftenly applied by using lubricating jellies, because that is going to provide a lubrication, and thus with the help of lubrication that facilitation of that instrument into the body orifices can occur without any hassle. So, it is very important that such type of jellies needs to be sterile, and they are supposed to be free from microbes. Then lubricating jellies are applied onto rectal thermometers. So, if we want to insert thermometers rectally, we may insert rectal thermometers. If we want to insert into the urinary bladders, the instruments are supposed to be filled with lubricating jellies, and then they are supposed to be inserted. Another application includes using of lubricating jelly on finger stalls or on cystoscopes, sometimes on surgical gloves as well as catheters. So, whenever we are going to use all these type of instrument, the very much and very important part here is we have to apply lubricating jellies on them, because by the application of lubricating jelly, the facilitation or the transportation of these instruments becomes easy, and it becomes less painful for a patient to bear the pain, because this lubricating jelly is going to provide lubrication. As a result, the pain is being lowered and the facilitation is being easy, and the facilitation is sometimes made very easy. Now, there are another type known as miscellaneous jellies. Miscellaneous jellies, I just now said, it can be useful for any other purposes, or it has a major range of purposes. It is useful for patch testing, like for it whenever we want to undergo patch testing, then for that purpose, for testing or for adhering that patch onto a particular area, we use miscellaneous jellies that is free from any sort of API. Then it can also be used as a carrier in electrocardiography, or to reduce the electrical resistance between the skin and the electrode. So, whenever we want to perform electrocardiography and we want to decrease the contact time between the skin and between the electrode, what we do is we apply miscellaneous jellies, so that help us to reduce the contact time and the friction between the skin and the electrode. So, in the previous slide we have covered about the different types of gels and jellies and its uses. Now, we are going to cover poultices or cataplasm. So, let us understand what are poultices or cataplasm. Nowadays, poultices or cataplasm are not being very much used. They have actually lost its existence, because this is something that is being replaced by transdermal patches. However, let us understand that what this sort of delivery system was a primary sort of delivery system which was used by our ancient saints, ancient pharmacists, ancient apothecaries. However, such things are not being practiced now. We may find some cataplasm or poultices, but the demand for this is being replaced by transdermal patches. However, let us understand what is poultices or cataplasm. It is basically a wet mass of solid substances. So, solid substances means what? Anything that you want to apply onto the particular surface. It is majorly of wet consistency, majorly used on skin surface. It is applied onto the skin surface, and it is used majorly as a counter irritant or inflammation reducer. When we want to reduce the inflammation on a particular tissue, or when we want to use it as a counter irritant, we choose poultices or we go for cataplasm. However, as I just now discussed, this is being replaced nowadays by various other sophisticated sort of dosage form. Just now I have said it is being replaced by transdermal patches, and nowadays nobody wants to try this ancient sort of medicine, that is poultices or cataplasm. Then it is a mode of application that includes heating the formulation and then applying onto the skin surface. So, this is an important point that makes cataplasm or any other sort of delivery dosage form different from other one. When we want to apply cataplasm or poultices on any surfaces, the very first thing that we are supposed to do is we are supposed to heat that wet mass. That wet mass that we are supposed to apply onto a particular part, we are supposed to heat that wet mass and then we are supposed to apply onto a particular surfaces. It is often applied as hot preparation only. So, here the major thing that makes this poultice or cataplasm different is that it is oftenly applied in a hot temperature. The temperature of the cataplasm or poultices must be a little raised. So, as we can see in this diagram, this patient is applying a wet mass. So, this is nothing but a wet mass. This wet mass is often of a high temperature. So, it is hot, but let me be clear here, this hotness is being tolerated by that patient. It should not be too hot so that it burns that affected area. So, it should be of a particular temperature that is being tolerated by that particular patient, and this wet mass is being adhered to the affected area where it is to be applied. So, what is going to make what is going to adhere this, because it has no base, it is just a wet mass of the solid substances. So, you can apply a cloth, as you can see this patient is applying a cloth here, and we just have to keep this cloth tightly bound to that particular surface so that our medicament is adhered to our skin surface at least for a period of between 4 to 6 hours. So, this is all about your cataplasm. So, another form of semi-solid dosage form is nothing but suppositories. Suppository is nothing but it is a medicated solid dosage form. However, as I have said here, it is written here solid dosage form, but under special conditions or whenever a suppository is being inserted into the body cavity, the solidity or the firmness of the suppository gets melted by the temperature of our human body, that is 37.5 degrees Celsius. Hence, it turns into semi-solid dosage form. Hence, it is also classified as a semi-solid dosage form only. So, suppository, when we hear this word suppository, it is oftenly made to get inserted it into the body cavity. That body cavity could be rectum, it could be vagina, or sometime it could be urethra. Apart from these orifices, the suppositories are also inserted into the nose, sometime into the ear. So, we can add here nose and ear as well. So, suppositories are oftenly made in order to be inserted it into the body cavity. Another thing, that after insertion they melt or they liquefy at body temperature. As I said that initially at room temperature suppositories are solid in state, but whenever we insert these suppository into a particular organ, what happens that they get melted because of the heat that our body maintains, that is nothing but the 37.5 degrees Celsius. Under this temperature, it is mandatory for a suppository to get melted. If the suppository do not melt, there is an issue and the medicament may not get engulfed or may not get they may not get stabilized there. Hence, in order to produce a particular action, it is necessary for suppository to get melted from on the area where it is applied. Now, vaginal suppositories are often called as pessaries, and they are made as compressed tablets that disintegrate it into the body fluids. Now, I just now have said that suppositories are inserted into various body cavities. Sometimes it can be urethra, it can be urinary bladder, it can be nose, it can be ear, and sometimes it can be vagina as well. But here the thing that distinguishes vaginal pessaries from any sort of suppository is that the site of action, the size or the dimension of the suppository. Whenever we want to insert suppository into vagina, it is not called as suppository, it is called as pessaries. So, here the thing that is going to distinguish suppository from pessaries. So, let us understand types of suppositories. So, suppositories are classified into 5 major types, that is rectal suppository, vaginal suppository, ear cones, urethral bogies and nasal bogies. So, it is self-explanatory and easy to understand that whenever we are supposed to insert suppository into the rectal or into the rectum or through the rectal route, it is known as rectal suppository. When we are inserting the suppository into the vaginal route, it is known as not vaginal suppository, but it is known as pessaries. However, if we want to insert suppository into the urethra, it is oftenly known as urethral bogies. The shape and size of the suppository may vary. depending upon the action. For example, if you want to insert anything into the rectum, the size of the suppository is going to vary. If you want to insert suppository into vagina, then definitely the size is going to vary. Size, shape, dimension is definitely going to vary. If you want to insert suppository into the nasal cavity, because you want the suppository to go into the nasal cavity and melt there and produce action. So the thing that we make is nasal bogies. And in the same manner, if we are formulating a suppository in order to get it inserted into the ear cones, the suppositories are known as ear cones, or you can evenly called as ear suppository. As a result, these are some of the types of suppository, majorly called as rectal suppository, vaginal pessaries, ear cones, urethral bogies and nasal bogies. So depending upon the site of action, depending upon the area onto which or onto the orifices onto which you want to inject or to insert a suppository, the name, the type, the shape and the size of the suppository is going to vary. So let us understand the advantages of suppositories. So why are we choosing suppositories? First of all, it is whenever we are not sure that the oral route is going to give a successful result, we are not going for oral route. So whenever a patient is unconscious and cannot digest anything or cannot take any medication through oral route, definitely this route, that is a suppository route, is going to pave a way for us, or actually is going to be a boon for us. So if oral route is not useful, we are definitely going to select a route that is nothing but the semi-solid route or the transdermal route or the vaginal route, that is classified as suppository route. Another advantage is whenever a patient is going through any sort of GIT problems, or the patient has nausea, or the surgery has happened to that particular patient. So in special circumstances, we may not go for oral route because the patient is unconscious, so the patient is not in a condition to take any medication. So what we are going to do? We are going to stop the so we are basically going to stop or to prevent the using of oral route, and at the same time we are going to prefer the local route. Sometimes if a patient is going through a constipation, we can definitely go through the rectal route as well. Another advantage is that there is an avoidance of first pass metabolism. First pass metabolism is definitely avoided when we are inserting suppository into a particular body cavity, because if the suppository enters a body cavity and gives action, there is no need to pass that suppository into the GI fluid or into the gastric pH. So harmness or the degradation of the suppository can be lowered. So high action can be obtained. So avoiding of first pass metabolism is also an advantage of suppository. Drugs with unpleasant odor, bitter taste can also be administered. So if a drug has got an unpleasant taste and the patient does not accepts that drug, so in such cases also we can formulate the suppository of that particular medicament. Now unstable drugs which are susceptible to gastric pH or to any sort of environment, acidity, so for that also oral route is a big no in that phenomena, and we can go for suppository route, or we can formulate the suppository. So for that avoidance of gastric pH can happen. Eventually drugs having GI side effect, if a drug is producing GI side effect, for example it is producing gastric ulcers, it is producing vomiting. So if a drug does not passes, or if a medicament does not passes the GI tract, it is not going to produce any GI side effect. So in such cases we can definitely formulate the suppository of that particular medicament that has GI side effect. So we can lower or we can decrease the occurrence of GI side effect. So this is all about the advantage of suppository. Here is the disadvantages of suppository we are also going to understand. So very first disadvantages is that it produces mucosal irritation. If again and again you are applying suppository to a particular orifices, and that orifice is continuously being exposed to that medication, it may lead to irritation of that particular mucosa. Another thing, leakage. Leakage is a very important problem, because we know that whenever we insert suppository onto a particular organ, the leakage may happen, and most of the medicaments may ooze out from the particular organ. As a result, the efficacy gets decreased or it gets lowered. So this is another problem in suppository. Another thing is that it has got a stringent storage condition. So, whenever we want to store suppository, we are supposed to store them in a very much stringent condition, because we do not want them to melt before insertion into the body cavities. So, various stringent body storage condition is required as when it comes to suppository. Another disadvantages is that it produces a feeling of discomfort. Hence, any adult will not want any medical practitioner to insert in the body cavity into the private organ, because that may lead to uncomfortableness, uneasiness. So, it definitely produces discomfort to a particular patient. Then large scale production is very much difficulty and costly. So, it is an expensive thing, and this is another disadvantages of suppository. Then concluding, bronchitis is another phenomena that causes the inflammation of the rectal tissue. For example, for a constipation, if we are inserting the suppository again and again to the rectum, that is going to produce inflammation of the particular tissue. Hence, bronchitis may develop. So, these are some of the disadvantages of suppository. So, that was all about the another and the various types of semi-solid dosage form. So, we covered gel, jellies, suppositories and various other semi-solid dosage form. I hope this lecture was very informative to all of you. So, thank you so much.